Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog, literally the fog, that exists at the leading edge of healthcare technology. I'm really pleased to have as my guest today none other than Susan Clark. Susan is currently serving as the Senior Director of Program Development at DirectTrust. DirectTrust is a nonprofit trade alliance. They're really a pioneer in offering technical trust and confidence in the secure exchange of health information. Susan, thanks for joining me on this episode of the Tate Chronicles.
I am so happy to be here. I haven't talked to you in a couple years, I think. So this is awesome.
Yeah, it's good to catch up. Well, let me ask you a few things kind of related to DirectTrust. DirectTrust simply states that as its mission is advancing trust in health technology. Why is the issue of trust so important? And what needs to be trusted? What's the trust all about?
The why is where I get the most passionate, I think, because especially now, that given the reach of data as data extends further and further and out of bounds of HIPAA, and we have to trust. And if we don't trust, we don't want to share, and we need to share in order to make people healthier and thriving. And if we don't trust, we're not going to engage in a business relationship. And if you break trust, it may never recover. So if you lose someone's trust, whether it's a patient or partner, whatever the case may be, it's really hard to get them back, or reputationally, just thinking security wise in that regard. But so it's a matter of safety and livelihood for all of us. So it's a pretty hard passion point there, and
sure.
We kind of hit it in a few different ways.
That's what I want to ask you about. How does DirectTrust promote trust in healthcare information?
Yes, so few different arms now as we've grown a little bit. I've been here since October of 23. But I've been friends with these folks for many, many years, because I think you and I and them, we all came up through meaningful use and promoting interoperability. And prior to me joining, they merged with an organization called ENAC, which is Electronic Health Network Accreditation Commission, which made it an even bigger arm of trust. So kind of the different pieces. One of those, I guess, since I just hit on the commission, accreditation is a very big part of what we do. So we verify, certify conformance with established policies, predominantly rooted in privacy and security, NIST standards. So we have multiple accreditation programs, based privacy and security, but then a lot of other specialty areas added on, like we do the accreditations for controlled substance prescribing of technologies. We do claims clearinghouses, health networks, HIEs. So, and we have a lot of just kind of subspecialty areas with privacy and security at the base, and we're an assessor for high trust too. So we're all about the privacy and security component of trust, of how do we assure that folks are keeping their information secured.
And then, I'm sorry.
Ahead.
No,
that was one.
Okay, keep going, Susan. Yeah.
We can go wherever you want, but and just and kind of going backwards to the base of where DirectTrust started. I mean, as a you mentioned nonprofit trade alliance, but we are, as an ANSI accredited standards body. DirectTrust was born out of the direct secure messaging protocol, which is still the standard that we hold today, and we continue to develop those trust frameworks. So we accredit also the HISPs that then run that information, issue the direct messages, those kinds of things. We all the credentials and facilitating the directory. So that's a really big thing. And we've actually just made some massive policy changes to improve that directory service. So making sure those certificates are in place. And I can't go too deep on that because I'm not that technical. So I can just say the words, but
Yeah.
we can bring people in to tell you more.
Susan, when I hear the word trade alliance, I kind of think that there's some stakeholders being brought together.
Yes.
So who are the stakeholders that DirectTrust brings together?
Yes, that's awesome. And it's been super fun for me to get to interact with all of these folks because in my prior role, I was predominantly working with health information exchanges and state governments, which was super cool, great experience. But now I'm really expanding because DirectTrust at its core is the trade alliance has members. I'm air quoting even though you can't see me. So we have a membership, and those folks are those HISPs, so those technology vendors that do that work, but also all of those who may use direct secure messaging or other technologies or standards that we hold. So you'll see interoperability vendors, HIEs, EHR vendors, population health vendors, consumer apps, identity, clearinghouses. So it's like we have quite a few. We have a couple health systems. We'd like to get some more in there. And we have some great consensus bodies and actually put a pin in it. Future aspiration coming hopefully soon. It will be a consumer roundtable because a lot of people don't know that individual persons can have a direct address. So what can that look like? What can we do with that?
Well, and you mentioned that is one of the things that is part of the TEFCA regulations is that individual access.
Mm-hmm.
Now, I don't know if that means those folks. I'm not sure how the different qualified health information networks are going to provide that type of individual access. I guess they're going to charge for it, or some may charge, some may not. But to have individuals to be able to get that information, that certainly has been promised with third-party apps and portals that are made up of portals and everything else. But that's the first I've heard about individuals having a DirectTrust, address. Yeah.
Yeah, and kind of that on that third-party app side, just thinking of our accreditation arm, switching back a little bit because we have accreditations for health apps, both whether they're HIPAA covered and dealing with PHI or otherwise. So we have kind of different tracks for those, and then and which also includes the Karen Code of Conduct, if you're familiar with that. On consumer health apps are assuring that they are secure and following good protocols. So that's actually an avenue that I seek to talk to those people more often than anyone of how can we, so from my personal passion kind of point, it would be how can we assure the public that when they're getting an app, downloading an app, that it is going to be secure? What's that seal going to look like? How do we make a DirectTrust health app seal of approval? Like you go to look in the app store and go,
yeah,
oh, okay, cool. They've done this work.
Right.
That's great. So that's my dream to give people that assurance that maybe some apps are built a little better than others.
Well, trust, I guess in some ways trust can be a noun, in some ways it can kind of be a verb. So I guess there's some cultural aspects of this I'd like to hear your thoughts on. So if I'm part of I'm a provider and accessing information from outside my database or patient's record, I am hopefully, I guess, to take it seriously, I have to trust that the patient identification is accurate, or I'm not going to trust anything. But I've seen many occasions back when I was on the healthcare delivery side of things, where providers would not necessarily trust outside data. And I say that because unless they knew who the referring provider was or who they were getting the information from, there was a hesitancy in trusting that data, because they really weren't, the validity of where that data was coming from or who had created that data. So there's seems like a cultural thing that I guess we're going to have to get through somewhat, of trusting a third-party data. Do you think about that at all? I mean, is that an issue?
That's so great, because I was making a note before you started talking that I wanted to hit on this, so this is perfect. Because identity is, starting with that, is so critical. And one of the big aha moments I had for myself coming into DirectTrust, because having been a very, very long time member of AHIMA, where we were very advocacy focused on patient matching, so persons matching, that was when I heard identity, that's all I thought was and where you started, of how do we know we've got the right patient, they're not duplicating, we don't have overlays. And then coming here, identity is way more than that. It is also endpoints and entities. And so that's a big part of the work that DirectTrust does, that I'm, kind of blows my mind when I sit on some of these meetings, like our Pearls work group, which is privacy enhancing record locator service. Side note, that we're looking for members for that group to contribute. So if anyone wants to participate, let me know. But so there's so much more out there and possible with identity. And there's a lot of technical solutions that I couldn't even begin to tell you about, but I'll watch these presentations and go, cool, there is a potential future if we can all coalesce around which standards there are. So I think that's a big part of, and also, we participate in the Patient ID Now Coalition, as does AHIMA. And so there is a gap there. No one owns that as an authority to say this is the standard we will use. Other than, we do have the Match It Act out there now, which is just a baby step on can we get Congress to put at least some emphasis on it, to say here, ONC or CMS, like this is your job now. So anyway, sorry, I got a little bit on my soapbox. That's a passion point.
Sure. Well, that's good. Well, one thing you mentioned was AHIMA, and I ran across a email today that had the word AHIMA as well as Susan Clark in it. So tell us what that's about. Sounds like you're up to maybe becoming czar of something, potentially. I hope so.
I mean, I do always love putting consonants together in a word like czar. That amuses me. But I am just still kind of in a haze, a happy shock of that I am on the ballot this year to run for president-elect of AHIMA. So
congratulations.
Just went public today. So thank you. It is a true honor and something I'm super passionate about. So thank you for recognizing that.
And for somebody who's been in the trenches for years and years, that's who should be nominated for these things. Somebody who's seen it, from way before meaningful use. Speaking about meaningful use, though, the federal government, through its initiatives, EHR incentives and meaningful use incentives, for gigantic amounts of money directed to providers to not only help finance EHR systems or buy them outright, but to fund regional extension centers to help train providers to be meaningful users of the technology. I'm not seeing that so much on the interoperability side of things. Is that for political reasons, or, it seems like that worked under meaningful use. Are we going to need something like that, hopefully, under interoperability?
Oh man, I personally am so passionate about that. Even long
Mm-hmm.
before I was at DirectTrust, I put so many comments on federal rules or state strategic plans about recommending other technical assistance programs of various types, because whenever you look at what the issues are, no matter how good the technology is, it's the implementation, education, workflow, and that's the people who do that work, and it's sorely needed in so many cases. So I have advocated for it, especially, but I know typically it's funding,
Mm-hmm.
and prioritization and authority. So
Right.
whose authority to create a program, and then are they funded, and
Right.
where does that sit? And actually a little bit thrown around recently, if anyone's been following the testimony, congressional testimonies on cybersecurity from all of the big headlines
Mm.
that we've recently had, there are words said again of whether we need to do a funding type, a technical assistance type program again for specifically for cybersecurity. So that has been thrown about. I don't know, how much that could be realized, but I think that's a lot of the issue, that no matter how many regulations you put in place, if you tell healthcare organizations you just need to do X without telling them how to do it, if they've never
Mm-hmm.
done it before and don't have the resources, how do you expect them to effectively do that?
Absolutely. Let me mention to the audience, if you're just joining us, I'm Jim Tate. And on this episode of the Tate Chronicles, I'm speaking with Susan Clark of Direct Trust. Susan, time's flying by here. We only have about 10 more minutes. I want to make sure I capture your thoughts on some other things. Um, Emerging technologies such as AI, how are they affecting the issue of trust, both from I guess, a positive, but also kind of a negative potential in the hands of bad actors? So these emerging technologies that have kind of come out of the blue in the last few years.
Yes. And AI is the big buzzword. We couldn't get through this call without
I
somebody
know it.
bringing it up, right?
Right.
But it has, a name, or rose by any other name, has existed in some other mechanisms, but it is really bursting out of the seams now. And I have several thoughts on it. That first of all, just thinking of all the places where it's used, and for it can be good or it cannot be good. So thinking of, we're hearing a lot around the clinical aspect of those algorithms, biases about
Yes.
accuracy, and there's so many implications to safety on that, and that totally makes sense. Just from maybe that is where I'm going to be less. I'm not a clinician, so I'm not going to be able to weigh in a whole lot. But I think on there's a lot happening in revenue cycle with AI that can really reduce burden. I think there's a lot of potential there, but something kind of on that front. One of the other things that when I was just on the Hill with the HEMA, one of the things we were going to our legislators about was on the AI workforce for non-clinical things, because
Mm-hmm.
same idea is like there's all this emphasis on clinical, but guess what? There's a whole bunch of, we're going to need a workforce, kind of going back to that technical assistance thing. We need a workforce that can support this, and how do we upskill or build into educational programs how to be ready for this in the future? And then I had so many thoughts at once, sorry, but the other one on security.
Right.
So cybersecurity, as fast as we try to get ahead of it, the bad guys are using AI to, to work against us. So we have to use AI in the cybersecurity space in order to, if we have any chance of protecting our organizations.
Exactly. There is, I really concur with what you're saying, that um, my opinion, just that AI in healthcare, uh, um, the back office or administrative type of things sound like a really good way to start.
Mm-hmm.
Um, Before AI comes into clinical decision support, which it's already in, and treatment protocols and things like that, um, th- there's so much more at risk there. And you kind of touched on algorithmic bias. That's in the system right now. And
Yes.
so if these systems are trained on people predominantly with European DNA who have insurance, that we don't want to go down that road. So,
Right. That's a bigger, that's a whole other conversation.
right, exactly. But let
Oh,
me
you know
go
what,
ahead.
Jim,
Go
can
ahead.
I say one more thing? Just
Please,
because
sure.
it's very relevant. Something I heard this morning. Chris Ross of the Mayo Clinic was
Hmm.
a keynote on Wheaties conference and on AI tools that they're becoming more cheap and more accessible. But it's what I actually wrote this quote, it's not cheap to structure, govern, or protect that data. So we have to make that investment as well. So I have to like put it on my data governance emphasis. So that's
Well,
all.
that's so true. And I don't know the folks or the entity that took down Change Healthcare, but they had one goal, and that was to get ransom out of Change Healthcare. I believe they got it. But the collateral damage that was done downstream to all those clinics and providers who could not bill and still cannot, are just terrible cash flow crises. Yeah, it was all just collateral damage. It was like a dirty bomb that got thrown, and they got their ransom. But the damage that was done downstream was just, I don't know, it'd be some time before we even know everything about that.
It's kind of that case of you don't think it's going to happen to you until it does,
Exactly.
and
Yes,
how many people were impacted. So,
and are still being impacted. We only have a couple more minutes here, Susan, but I know that DirectTrust has an annual conference this year, September 22nd through 25th in St. Louis. What's going to be the focus? What are some of the themes? What are you going to be working with there?
well, I am so excited about this. Well, first of all, not the themes or the focus, but we have the coolest events. We're going to have dueling pianos, and we're going to go to the City Museum. And
Mm,
so I will be your hostess with the mostest. So come on over. We're going to have a good time. But the kind of the themes for this are our pathways, so to speak, our tracks, which programs should be out pretty soon, are on interconnected health. So our core
hmm
interoperability, what's happening there, risk and resilience, what we were just talking about. So strategic approaches to compliance and how do we manage that trust by design? So how do we build digital identity and technical trust into healthcare? Solution fusion. So we want to hear what kind of partnerships are happening where we didn't think they were happening, and tell us about that.
mm,
And then
hmm
envisioning the future. So navigating next wave of innovations, that emerging technology focus. Oh, and we have 3 keynotes announced. So we
Oh,
have
yeah,
Mickey Tripathi, our national coordinator from
sure.
OSC. And we have Susanna Fox, who is author and former CTO of HHS. And we have Greg Garcia, who is from the Health Sector Coordinating Council and Cybersecurity and just testified to Congress. And he is a wonderful speaker. I'm so pumped about getting this going. So please, early bird registration ends May 31st. So if you get this published in time, so hopefully people start registering.
St. Louis, that's where the big arch is, isn't it?
Oh, yes, it is.
Have you been up in that thing?
When I was 3, there's
Really?
pictures, but I don't have a memory of it. So, but I've been there many times. I grew up in Illinois, and my parents were St. Louis Cardinals fans, so I more know the old Busch Stadium. So I'm excited to. Also, if you get there a little early, the Cardinals are in town until
Oh,
the day
really?
of our conference starts. So come see some baseball. That's super fun too.
Well, before we say goodbye for today, Susan, how can our listeners find out more about the conference and just about DirectTrust, about what you're doing?
The easiest way is to directtrust.org. It's real simple, and all of those things are on our website. I want to commend our awesome marketing and web teams. I think we have a pretty coherent, cohesive website, and also we're very active on LinkedIn. You can find me there. You can also find me under hashtag Health IT Rockstar. I verified that someone told me that they couldn't figure out how to find among the many Susan Clarks, and tried that, and it came up right away.
Okay,
so.
Good. You must have grabbed that early on because everything else has been taken, I think.
Most of it, I lucked right into it, and it's become my theme now. So.
Well, perfect. Well, to our audience, thanks for joining me on this episode of the Tate Chronicles. And of course, I offer a special salute to my guest today, Susan Clark of DirectTrust. Susan, thanks for coming aboard today.
Thank you, Jim. It's been a blast.
You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.